Okay. Thank you for joining us today for Thrive's presentation on virtual learning dropouts, how to get students back to class. I'm Pat Hovey. I'm the Executive Director of Thrive Alliance Group. My background includes almost 30 years of experience in the public school classroom, both as a special education teacher and a general ed teacher. I was also a director of special services. Just a note for housekeeping, please use the chat box where you can write your questions. If we don't answer your questions during the webinar, we'll send you a response by email. And this is my colleague, Chris Leonard.
Thank you, Pat. Hi, everybody. I'm Chris Leonard. I've been an educator for about 30 years, social worker and psychotherapist for just over 25. I've served in a number of roles in schools. I've been a teacher, I've been a school counselor, I've been a child study team social worker, I've been a principal, and I've been a director of operations. We are pleased to be here with you today to talk about the problem of virtual learning dropouts, and we are ready to go. So there are students right now who aren't showing up for virtual learning or hybrid learning. And this is a super concern. People were thinking when the pandemic emerged and we went virtual, that school refusal was over, but it is far from over. A lot of the kids who aren't showing up had poor attendance before the pandemic started, and they're having poor attendance to their virtual classes now. In some cases, they're showing up, but they're not doing their work. In some cases, they are failing multiple classes. The kids of the greatest concerns are those who don't even respond to our attempts to connect with them, and we can't even reach parents. So the question is, what do we do? Furthermore, the problem is getting bigger. You know, typical attendance, non-attendance is like 5%, but now the non-attendance is reaching the 10% mark, and in some cases it's even higher. And this is true whether students are in person, full-time, remote, or hybrid. During the pandemic, we're collecting data, and this continues to tell us of absenteeism, but it doesn't really tell us what's going on. What we want to do is we want to use the information to help students rather using it for punitive measures as we typically do with attendance data. This will help us address the issues and get the student and family started on a path to get re-engaged by developing a positive relationship, which is really necessary to foster the long-term progress. So how do you get virtual dropouts back to class? Typically, schools have tried 3 things. You know, when the pandemic first started, a lot of schools did a really great job of training up teachers on using Zoom, on using Google Classroom and other platforms. They offered parent workshops about best practices for virtual learning, about how parents could be supportive. And the other thing that schools did is they really tried to bump up their digital infrastructure, and they tried to lend devices to kids. Schools really made a Herculean effort to be ready. Even with all of that, we still have this problem of virtual dropouts. So let's look at another option.
So this includes a 4-step plan. And here are the basics to that plan. We'll go into detail for each of them as we go along, and you can use these as they fit your needs. So first, you'll need to assemble a team with the goals of research. You want to address the varied disciplines, and you want to have collaboration toward global interventions. Second, you want to try to compile the resources that may assist in addressing the problems. And these may be in school or extra outside of school. Third, after you've exhausted all your other strategies and you've collected the pertinent information, you'll want to conduct home visits. And fourth, but probably most important, you want to follow up with supports that meet those needs that you identified with your research. And you want to make sure that they meet the needs of the families, of the students, and also of the staff.
So you want to get this team together. And obviously the first people that we think of when we're gathering a team to work with kids who are struggling in school is the child study team members. We also think of our SACs and school counselors, but you really want this team to be multidisciplinary. It's really best if you have people from all walks of life in the school. So you want your principal or other administrator. You want teachers, especially teachers who have established good relationships with the student in question. Ideally, you would like to have a mental health expert on your team because they really can help you get in there and understand what might be driving the non-attendance. Even better, have your school physician involved. In some cases, the school refusal is more like truancy, and this is where law enforcement can help. And in many cases, outreach is helped if you have somebody who's multilingual who can help you translate with parents. Once you get the team together, the only way it's going to work is if you have an established process in place. One of the most important things you want to do is make sure you have regular meetings and that you get them on the schedule. If you just say, oh, we'll get together next week, it probably won't happen. You want to know how kids are going to get to you. What are their criteria for knowing when a kid needs help? Then you want to have a plan for what your intervention strategies are going to be. So you want to really make sure, how many absences is it going to take before we refer a kid? How are staff going to let us know that they have a concern? Does the student information system trigger a referral? You want to look at what have you already tried? What were your previous interventions, if any? How are the students' grades? Are they maintaining an average GPA, but the attendance is poor, or are they really struggling academically? So you want to have this really kind of comprehensive outline of strategies, and you want to use resources to find strategies that are going to work for the particular issues that you're seeing in your school. And then you want to really make sure that everybody on that interdisciplinary team knows exactly what's expected of them. So determine the strengths and skills of the group and leverage those strengths.
So now it's time to compile the resources. An important component of any intervention is having the knowledge of resources available to your students and their families. So you'll most likely want to compile a master list of resources. And from this, you can create that at a glance reference. It can be a card, and you can provide it to anyone who might need it. So when you think about the resources, when making this, you want to consider to make it handy, like a refrigerator magnet. You see it all the time. Or that you might want to laminate the cards so that it doesn't disintegrate in a drawer. It should be visually appealing and easily read. And this can be useful for both your staff and your families. And in it, you should include things like children and family, local and state agencies, any emergency intervention agencies, food pantries, service providers inside the school and outside the school, housing authorities, and shelters for female and male, whoever might have to need that. So once these school-based interventions are exhausted, it's time to start to explore a home visit. We'll be working within the parameters and restrictions of a pandemic for the foreseeable future. So let's review some of the things that we'll have to consider. When making a home visit, you must maintain the health protocols set by the CDC. Be consistent when at the home, and you should be modeling for the family and supporting your colleagues in maintaining guidelines. Be sure to address what makes everyone involved feel comfortable. Utilize best practices. Ask your caregiver what makes them and everyone in the house involved feel comfortable. Ask how they practice the protocols. Describe how you'll be compliant with the protocols. Encourage and praise this cooperation, because by doing these simple steps, you provide another opportunity to establish trust within the family, and the students will see how that trust is built also.
So let's look at specifically what you do when you're actually going on the visit. You want to make sure that you're doing this in a manner that's similar to a well check visit, which is something that you may have already done. So what you want to do is determine the steps that you're going to need to be encouraging, to be supportive, and to develop a plan in conjunction with the student and family to get the student back to school. You can bring that at a glance card that Pat talked about with you, because that can, a lot of times that can create or contain the resources that the family needs. Remember that you're there to assist, you're not there to punish. So what do you want to do before? You want to make sure that you've done a little research on the student and get an idea of what the need might be. And then based on that assessment, pick the right pair of team members to make the visit. So for example, if the primary language in the home is Spanish, you want to make sure that you take somebody with you who's bilingual. You also want to understand cultural differences of any kind, depending on the family's background. It is imperative that you never go alone. Really always make it a pair of people. A pair of people is enough for you to support each other without being overwhelming. More than two, not a good idea. As Pat said, remember safety first. Observe those CDC protocols, wear masks, social distance. You may not even need to go in the house. You can talk through the door. And if in doubt, bring law enforcement with you. Remember that attitude that you're there to help, not to punish. And the message that you want to give to the family is, we want to make sure you're okay. So once you're there, what do you look for? Most importantly, you want to get eyes on the student. A lot of times you'll get to the door and you'll be told, oh, they're in bed. You want to see if you can get them out of bed and coming down and talking to you. You're looking to see that the environment is healthy and safe, that the student is in good physical health, because after all, regardless of any time you have an absence, you want to rule out a physical health issue first. Is technology an issue? Does the student have no access to a computer? Is there no internet or wireless, or do they have difficulty navigating? Are there any kind of environmental issues that are getting in the way? For instance, does the student have no private space? Sometimes family lives together in a very small space. Are there signs of a mental health issue? Are there signs of an issue with the parent? Is the parent either enabling or encouraging the student to stay home? Or conversely, is the parent disengaged? Are there language issues? Is this a single parent who's an essential worker, who's never home during the school day? All of these things are things that are going to give you your data so that you know how to intervene. So you want to be able to interview the student, and you also want to interview the parents. So what kinds of things do you want to ask? You want to know about any trauma. Is there an illness in the family? Have there been recent deaths of loved ones? Is the family really worried about becoming ill? Is that one of the reasons that they're disengaged? Are basic needs being met? Is the household stable? Have the parents noticed any recent changes in emotions or behavior? These sudden changes in behavior can be real warning signs of an underlying issue. As I mentioned earlier, are there physical symptoms or health issues that may be getting in the way? Does the student need to see a doctor? What are the relationships like in the family? Is this a family that's very close? Is this a family that's overly close or enmeshed? Is this a family that is emotionally distant from each other? Is this a family, what's the relationship with the community? Is this a family that's engaged with the community, or is this a family that's isolated? And then what's the overall energy level and focus? Do people seem kind of lethargic and depressed? Do people seem hyper vigilant and anxious? Or is it somewhere in between? These are all very important look-fors.
So now you've done your research, you've had the home visit. Now, what do? We have to follow up with the team, the student, and the family. You want to share that information from the home visit with your team to get their input. So discuss when and how to follow up and who should do it. Prioritize the need as you have determined through that investigation and with any collaboration that you've had. Start to assign those responsibilities to the appropriate team members. So if you're at the home and you're seeing those mental health issues, you want to pull in that mental health expert so that they can really get into why this might be happening. You want to include the teachers that are already working with the student. They may have information that's going to be pertinent also. That's a person that's already connected and getting into the home. So that's going to be an important component of your team. Assign a point person. Make it so that not 3 people are making the same phone call to the parent. If the students are staying home, most likely the parents or the caregivers are going to be overwhelmed as it is. So make it one person that can follow through. Now, they're not the only ones contacting it's not just the family, but it's also the staff. So that it's a constant message, a continuous message, a consistent message. And when you're creating the goals and objectives for the interventions, you want to use the guide of SMART goals. So with SMART goals, that's specific, measured, and you have a time sensitivity. You want it to be able to be something that you can accomplish and that they'll be able to do also. So it's not just in school, but goals and objectives that will be good with the family also. And developing the effective strategy to bring those school refusal kids back, it's an ongoing effort. It doesn't stop at the door once you've seen them. It's not only about COVID. There have been students missing, as Chris has said, they've been missing since before COVID, and we'll continue to see students missing after COVID. So by putting these steps in place, you have this set up for when you start to transition back. And we do have to think about when we transition back. So to re-engage those students who've become the virtual learning dropouts, schools need to involve the right people, create the right plan, and develop the expertise to make it all work. So how can you get started? So we recommend that you identify the gaps in your skill sets. So the effort to re-engage the students requires skills and competencies around mental health that most staff members may not have, including the child study team. Some of the child study team may not have the practice at this. And so once identifying the gaps you need to fill are critical. And the examples may be recognizing that there are mental health issues like anxiety and depression. We want to be able to help students manage any kind of mental illness issue in a school context. We may be working with students who are suffering from some type of trauma, or the family may be suffering from some type of trauma. You want to be able to assess for suicide risk or self-injurious behavior. We have to be intervening when students are in crisis, and what does that look like? And we also want to be able to address the behavioral issues that may be experienced either in the classroom, virtually, or in person. We offer a coaching and certification program that can help fill those gaps. The program consists of training along with regular coaching from experienced mental health professionals. First, the coaching consists of weekly small group sessions with a master level mentor designed to provide participants with interventions, strategies, and techniques to effectively manage the pressing concerns and urgent issues. Second, the training is a series of 12 online modules that cover topics such as hybrid learning, trauma-informed care, and crisis intervention. Upon completion of the training and coaching, participants become certified as a Thrive Certified School Mental Wellness Specialist, or a CSMS. This program was created for people like you who work in school systems and are passionate about helping struggling students to succeed. People like child study team members, school psychologists, social workers, special education staff can all benefit from participating in this program. We're offering to the participants of this webinar today a free trial of the program. The information and coaching you will receive during this trial can be used immediately to help your struggling students. The trial consists of one online training module titled COVID and the New Normal, which covers support for trauma, virtual counseling strategies, and how to support mental wellness for teachers and students during the pandemic. It also consists of one small group coaching session with a mental health expert, where you'll have the chance to get advice and information about the biggest problems you're currently facing. Additionally, you'll receive a certificate for 2 hours of professional development. The trial must be completed within 2 weeks of the start date, and you'll be required to fill out a survey upon completion. Due to the coaching component, we can only accommodate a certain number of participants in each trial session, so I encourage you to sign up quickly. You will also receive a follow-up email with a copy of the presentation and the link to sign up. I want to thank you for joining us today and hope you found value in our presentation. If you have any questions at all, please do not hesitate to reach out to us at any time. Be well.